Health Check.
If another pandemic comes up, I don't know if we'll be able to absorb that. I don't think we're ready.
We just pray that we don't have another one, because the last pandemic we lost about a number of people from COVID, and we're not willing to lose our relatives again.
We discuss the continent's public health surveillance status.
I don't think Kenya is ready for anything for now.
And discuss through ways the COVID-19 pandemic has influenced the need for improved health surveillance moving forward. Good day and welcome to Africa Health Check, where we reflect on Africa's health status. I am your host, Horontlejang Paladi. On today's episode, we will be discussing the continent's public health surveillance status. And to help me unpack this topic, our special guest for today is Dr. Evelyn Gitau, the Director of Research Capacity Strengthening and Acting Director of Research at the Africa Population and Health Research Center. I'd also like to welcome our usual commentators, Dr. Marianne Morathi, who's the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who is a pharmacist and a pastor from Ghana. Remember, we are discussing the continent's public health surveillance status, and I'd like to welcome Dr. Evelyn to the show. Thank you so much for joining us.
Thank you for having me, and thank you for that introduction.
Thank you so much, Dr. Evelyn. I did talk about your current work title, but maybe just briefly give us a background of who you are, where you're based, and how did you find yourself working in this line of work?
So, interestingly, I have had, as a researcher, I think my path to where I am now has been an interesting path. I started off as a researcher at the Kenya Medical Research Institute, almost 20 years ago now. My work was really focused on malaria and trying to understand how to better diagnose children who had brain infections. So that's where I started. And along the line, I got a small grant to try and come up with some biomarkers that would help us distinguish these diseases. And then there was a frustration because, when I say $100,000, everyone will say, yeah, that's a lot of money. But actually in diagnostics and in producing and in R&D, and I'm sure the Reverend will tell you very clearly, this is very little money. I mean, the scale of money that we need to manufacture diagnostics on the continent is really high. And that's why we keep having to adopt and adapt and be consumers of other people's diagnostics. So that led me to the next point in my life where I said, come on, we need our own fund for R&D on the continent. So I was a founding program manager for the Grand Challenges Africa, which was funded in partnership with the Gates Foundation and Canada and other players, and also trying to get governments to invest in this. I did that for a couple of years. By the time I left the fund, it was a $10 million fund. I now work in terms of looking at capacity strengthening for ourselves as researchers, but also for policy makers and for those who may want to fund but don't clearly understand what would happen. So I'm getting more business oriented as a scientist, but this is a language we have to learn to speak if we want R&D on the continent to address issues that we've seen, especially during COVID, where you can't test enough. And the last mile diagnostics, those who need cancer diagnosis quickly and early outside of urban cities on the continent will not get it unless we make these major investments. Over.
Absolutely in agreement with you. I mean, it goes without saying that public health as well as R&D closely resonates with you. Today, we are talking about public health surveillance. And for anyone who's watching and wishes to follow this conversation, I want you to just sort of start off by laying the foundation. What are we talking about? What are we looking at here when we are referring to public health surveillance?
So public health surveillance is, of course, where governments and those who are in charge of understanding disease patterns collect information and data, in terms of what's happening. So I'll give you an example of like where we are right now in Kenya today. Is we're in June 2022. We have a flu epidemic going on. We have a surge in COVID. We surprisingly have a surge in pneumonia. That's a disease that is covered by vaccines for children, and we have vaccines. So how would we be able to know when these epidemics are coming, when these small hotspots are happening in areas, and prevent them if we don't have surveillance data? So public health institutions need to have information. They need to be able to track. They need to be able to tell, because you need to actually roll out. I'm giving a simple example, but the simple example is maybe if we had started using masks again 3 weeks ago, the COVID surge that we're seeing now would have been prevented. But actually, the modelers had told us that. So surveillance allows us to have accurate information that informs interventions. And that's what we're talking about in terms of surveillance. Thank you.
And what would you say are the characteristics of what we would say a good public health surveillance system? And you could cite maybe examples in countries where they have a very effective public health surveillance system.
I'm going to smile at the word effective public health surveillance system, because again, COVID has exposed many things that the continent believed. So I'm going to start by trying to explain what I think we believed was an effective surveillance system, and what I think an ideal public health system would look like in terms of surveillance that would allow us to be able to address the inequities in health. So before COVID, we all assumed that northern partners actually have proper surveillance systems and can quickly track and detect and intervene as appropriately as we could. Now, if I were to take a stab at it, and I'll speak for many countries, and you've all seen the data, many countries have actually not been testing for COVID as much as Africa has been testing, okay? We were challenged by the fact that everyone said COVID is going to kill millions on the continent. But by the time it was coming to our country, we had a lot of people throwing at us many freebies. But then when you look at a country like the UK and you compare the level of testing that was happening in the United Kingdom in comparison to countries in Africa, it was actually comparable. And, in fact, we probably tested a lot more initially than they were. So what does that say about an effective surveillance system? Is that our beliefs that the North do it better than us, number one, we need to stop at that point and say, actually, they don't. We have had good examples of actually why we can and do some things better. In situations where we were presented with epidemics, the Ebola saw us actually learn how to very quickly start doing things and testing when we need to. We actually have built some surveillance capacity that equals any country's surveillance system. Now, what do we need, though, in terms of effectiveness of that type of capacity that we've slowly built? We need to scale it up. Now, that's where the equity question comes in. In terms of scaling up, have we actually got the resources to scale up? Do people see the need for us to scale up the type of surveillance that we're talking about? I don't think we do, but we do have the ability to do that if we actually improved and linked surveillance to effective R&D. So technologies for cheap diagnostics that would allow us to cheaply collect information, technologies of investing in artificial intelligence, for example, so that we can actually analyze the information that we're getting. These are things that the northern partners are doing better than us, because their computer capacity, their artificial intelligence capacity surpasses us, not in terms of knowledge, but in terms of infrastructure. I think we can definitely learn from many things, but I'll be a bit I'll give you an amusing that we've been looking at lately, this monkeypox thing. Africa had information and data about monkeypox. We knew what was happening. So we're not as badly off. I think we just need to use our own data to make our own surveillance work for us. Others then saw a few numbers and they screamed about it. So it's not that we are bad at surveillance. We just have to scale it up to ensure that it's informing what we need to have it in place.
Absolutely. I think I'm totally in agreement with what you're saying. It's also about where the data is available, what we do with that data. I was just looking at the news the other day that South Africa recorded its first case of monkeypox. And I was thinking, if this does not get under control, it's going to fuel mass hysteria as we saw at the beginning of COVID-19. But it seems so far we're all interested in just saying, monkeypox is at our doorstep. But what are we actually doing with that information is also really important, right? I'm going to go to Dr. Mary Ann, and I want you, just from your experience as a medical practitioner, share some concrete examples where public health surveillance systems played a really pivotal role in responding to a pandemic or an outbreak and helped in prevention as well as control of an illness.
So thank you very much, and great to hear Evelyn and the clear message that is coming out from here. We need to invest and invest more, particularly on the local talent and what we have here, and now even to hear about artificial intelligence. I can give you one of few examples where public health surveillance has worked or it's working, and it's not on the African continent. It's actually something I read, I've been following up today, and it's they have noticed that there's polio in the UK. And these are countries that had eliminated polio almost decades ago. And how did they detect that? By actively doing surveillance, looking at their sewage, because some of these viruses can be detected even before we start seeing symptoms, because sometimes they're excreted in some of the waste products. So they've been doing constant surveillance, and I believe also they've been doing this to note or to see if there's any COVID or SARS-CoV-2 virus rising within any population or cities or towns within the UK. And surprisingly, they've seen polio. And now this has made headline news on the BBC and CNN, because again, I think only 3 countries in the world have remained to be seen polio because, again, of failed surveillance, a war, and other collapses of the economy. So having a first world country seen polio is a big news. And again, they can look at it in either way. The surveillance is working, so they're upping up on calling everybody that is eligible for vaccination to go for their vaccination. They've started a debate of an old disease, and everyone is trying to go back to their books. What was polio again? But anyway, here in Kenya, we always do active surveillance as well. We try and detect. Our team at the University of Nairobi was one of the first teams that detected some bats in some caves in Taita Taveta carrying some particular strain of Ebola virus, and this has been published and passed on to the relevant authorities so that we can watch out any febrile illnesses. What we mean, any unusual fevers being reported around these villages where we have detected this. And that's how it should work. If you'd ask me, what are we lacking now? Because again, the African continent is not lagging that much behind in terms of detecting, noticing anything unusual. What we may really need to up our game on is artificial intelligence and then communication. We need to really communicate to our population, educate them what they need to watch out for, and also how to prevent. And again, that's one of the purposes of this program, of us being here, having this candid discussions on what we need to do and talk about various illnesses, infections, and trying to make sure that the public, we are moving on one step together with the public, with the funders, different stakeholders, the governments, and that way, I think in Africa, within the African continent, you'll start seeing an upsurge of R&D, of us having our own solutions to our own problems. And again, the world will start looking up to us for those solutions. And I'm happy that Evelyn has talked about even monkeypox, which we started reporting and seeing monkeypox many years ago. So I think if we had enough investment, we would be the first of the peoples in the world with a vaccine, and talking about who needs it most. But anyway, we'll get there.
Absolutely agree with you, Dr. Marianne. And I'm happy that you talked about the importance of communication, because I think in the next show, or the one after that, we are going to be focusing on the importance of communication in public health, which is something that we tend to overlook in the response to public health emergencies. Now, Reverend Achempo, maybe you can also weigh in and share some of your experiences, or that you know of, where public health surveillance was really impactful in responding to a public health issue.
Yes, Ghana was blessed to escape Ebola invasion into the country, partly because of the robust systems that were put into place, where surveillance is concerned. I remember that on all borders, Ghana with Togo, Cote d'Ivoire, Burkina Faso, people coming in, apart from the airports, there were groups of health officials who were screening people. And the concept of public surveillance is not a static, it is an ongoing system. It's something that is always in progress. And you'll be shocked to know that just about a week, or within a week, there has been one reported case of somebody with Ebola in the northern part of Ghana. And this actual research was in 2013 to 2016. And I do believe that they have maintained continuous ongoing research into finding who might carry Ebola. And just within a week, one person has been found to have contracted Ebola. So it is the way to make sure that our people are living in good health. After all, that is the goal of public health surveillance, to promote health and to protect the health of our people. So we encourage our government leaders, our health officials, to invest and to extend their wings of surveillance, and not make it only an academic and a scientific exercise. So Ghana is warm up to the idea of public surveillance, and it's working. It's working very well.
Absolutely. Thank you for sharing that, Reverend Achampong. So we have talked about the importance of public health surveillance and early detection and early intervention. On the other side of this, we will be making the case for enhanced investment in public health surveillance system. But let us do that after this break. Let's hear what people on the street had to say.
Yeah, I do believe in my country. I feel we can detect a pandemic. We have researchers, Kenya has very many learned people. We have the Camry, we can do that.
Another pandemic? I don't think so. We have not ever been ready for anything. We've always been catching up. So if another pandemic comes, I think they'll still catch us flat-footed.
Truly, when we just work together with the government, if the government will put those policies which are needed for our country to grow, then they will do the needful. They will really do the needful so that we can do the best for our level.
Welcome back from the break. Just before then, we were discussing public health surveillance system and how they play a pivotal role in early detection as well as early intervention and responding to public health matters. But now I want us to make the case for enhanced or increased investment in R&D for public health surveillance system. But before we go in there, Dr. Evelyn, I want you to just briefly share with us what are the current trends regarding public health surveillance system in terms of innovation, using the latest fourth industrial revolution technology, like earlier on you were referring to AI, nanotech, any trends that we need to look forward to?
I get frustrated that we cannot afford to make our mixes and the reagents that we need to go into some of this R&D is too expensive to get locally. So we have to import some of these things. As the minute you start importing reagents and you start importing raw material for anything, as you all know in industry, this drives the cost up. It makes it expensive. So China's rapid diagnostic tests are always going to be cheaper than the ones we have here because ours that are home developed and homegrown are too expensive. So in terms of the real investment, there are a couple of things that we need to first start looking at is what are the raw materials that we use and how can we make that cheaper? That's the first question. But I think related to that question is our energy sources. We have such huge problems in making energy cheaper. So how do we talk to policymakers to think about how we fuel, how we make R&D cheaper? Energy needs to be the primary part of that discussion. And I'm not in that space, but I know there's a lot of conversation that's going on about electricity and R&D and how to make it cheaper. Oil, there are things that we could be doing. Let's say we don't have the money to do the initial R&D. Can we make adoption cheap? Can we make things cheap for us to use? So as a Kenyan, there are things that I say we can actually do. Technology is something in Africa that we've embraced more than the rest of the world. Our financial system is actually improving at a rapid rate because the telephone technology and the mobile technology has become something you can use in rural areas. So if we can do that, if we can very rapidly embrace technology, there's a factory that is now actually making microchips here in Kenya. And that's going to change. I mean, in a space where COVID then made it difficult to get some of these things to build telephones, etc., there are things we can do, but we need to have the right conversation with the right people and in the right way. So when I'm presenting, I need to make a rapid diagnostic. Actually, I need filter paper to be made in Kenya. I need filter paper to be made in Zambia, in Malawi. I need, raw products in vaccines that are being made. They need to be made locally. We shouldn't be importing for any part of that place. And I think that's where we need to start. Yeah.
Absolutely. Thank you very much for that, Dr. Evelyn. And maybe to go to Dr. Marianne, what would you say are the main priority areas that we need to start investing in order to enhance the capacity of our institutions to carry out public health surveillance?
Yes, so for me, I think throughout the programs, I'm very passionate about the most powerful weapon we have against infectious diseases, and that is vaccines. We need to be able to make our own vaccines. We need to be able to strategize who needs it the most, and we need to continue educating our people what vaccines are and what they're preventing. And these are the gaps we saw when we were first hit by COVID. And also, I will not repeat when the vaccines are first rolled out. Again, we're waiting for the remnants coming from the Western world. So if we can just sit with stakeholders, governments, researchers, and every other relevant body, create a space where we can now start talking about vaccine manufacturing. And I'm quite excited to see that. I think that was yesterday in Kigali, where they're having a Commonwealth big meeting where all these world stakeholders, they broke ground for one of the first mRNA vaccine manufacturing plants in Kigali. There's also that conversation in Nairobi and in South Africa. So I'm really excited to see in the next 5 years what the potential of Africa will be with all these investments, everyone looking at us for now the solutions, because they have seen, hey, as Dr. Evelyn has mentioned, they thought COVID would break us down, but it didn't. So meaning Africa has some potential and we need to start now investing in this. So for me, it's vaccines, communication, and educating our people.
Thank you very much, Dr. Marianne. And Reverend, back to you. So the research and evidence have proven the importance and the pivotal, the quintessential role that surveillance systems play in responding to public health emergencies and different situations. But yet we are still struggling to secure the political will and the financing, especially domestically. What are we doing wrong?
Yeah, thank you very much. Yes, I was referring to Dr. Miriam's contribution about education and then expanding our capacity to investigate vaccines and their ability to contain some of these ailments. Most politicians come into government for their own reasons, but I do believe that there must be a system where priorities are given, in certain dimensions, certain areas, because let's come to it. Who would have thought that UK there can be a resurgence of polio in the UK, like Dr. Miriam cited? But the truth of the matter is that even when a community has overcome a pandemic, it is not to say that the virus are completely wiped out. So then there must be the need for an ongoing research, ongoing capacity building in order to contain. And besides, the vaccines are mutating almost every day. So why not understand this and then provide the political will and the funding to be able to secure the health of our people? Once again, a healthy nation is a wealthy nation, and this doesn't need any explanation to our political leaders. Yeah, education and then people to communicate. I do believe that the churches must come on board. I'm a pastor. There must be a section in our teaching, in our preaching, where the health of people are also talked about in the pulpit. So it becomes a concern of all.
Thank you very much for that, Reverend Achampong. And I'll take a parting shot from Dr. Evelyn. Maybe you could just give us your last words regarding the status of public health surveillance systems in Africa.
Thanks. So I think the parting shot I have really is to talk about the fact that we cannot achieve the goals that we have if we don't think about equity. So we can't concentrate the resources that we're talking about in small particular areas. Everything we've talked about in terms of surveillance is actually available in big cities on the continent, but we'll never achieve the type of impact we're talking about. Even the vaccine rollout, if we look at numbers, big cities achieved the numbers, the percentages that we wanted, but the last mile diagnostics, last mile surveillance, and last mile rollout of vaccines, where you're reaching everyone in an equitable way, is the only way we're going to actually change our health on the continent, so that then we can focus on other things beyond our poor health. Over.
Thank you so much for that, Dr. Evelyn. That's actually a really powerful ending to that, because like you're saying, some of these provisions, some of these services are available in big cities, whereas ultimately it's not just about providing for a certain few. We cannot say we have reached our ultimate targets in public health and universal health care if we are still not including everyone and ensuring that access to health care is equitable and accessible to all, regardless of your disadvantages and your geographical location. So let us keep pushing to ensure equitable access to healthcare services. Thank you so much for that, Dr. Evelyn, Dr. Marianne, as well as Reverend Anthony Achampong. This has been quite a really insightful conversation, and I hope that we'll have another show where we can come back and even decipher some of the issues, some of the trends that are coming up, and especially speaking to different stakeholders that can play a huge role in enhancing the capacity of institutions that provide public health surveillance across the continent. This is Africa Health Check. Do make sure to connect with us on all our social media platforms. We look forward to hearing from you. Until we meet again, same time, same place, same day. Remember that the future is Africa, the future is today.